My name is Carl Leroux. I'm a clinician scientist at work at University College Dublin, and I'm the coordinator of the Innovative Medicines Initiative Stratification of Obesity Phenotypes to Optimize Future Therapy project. Now, the shared value was a specific request from the European Union when this project came forward. And I'm illustrating this with our Greek character Sisyphus that was thrown into the depths of Hades. And you will remember what he did is he had to roll up this rock up this hill every day. And at the end of the day, the rock would roll down and he had to start all over again. And this is exactly what happened to the disease of obesity when different stakeholders were trying to do this on their own. Governments tried to treat the disease of obesity with their approaches for decades, and they were rolling this rock up, but every time the rock rolled down. And we want to change this narrative now to actually create a shared value so that everybody can benefit, all the stakeholders can benefit, and that would include patients, that would include clinicians, that would include industry, that would include government, that would include professional organizations. How can we achieve that? And of course, one of the best ways to do this is through science, is through generating new insights into the disease of obesity. And that's been a massive step up now that we are much better at understanding obesity as a disease. We are understanding it as a subset of multiple diseases. And therefore, we are able to now explore biomarkers, understanding the disease, and ultimately predicting treatment benefits. Now, the project SOPHIA, which is the stratification of obesity phenotypes to optimize future therapy, really are setting out to do two things. One, we want to find the predictors of risk, and two, we want to find the predictors of response, because those are the keys that can unlock shared value. Because if we can understand which patients are at highest risk of developing obesity or the complications of obesity, we could target those patients to actually help them the most. Secondly, if we can predict a treatment response, then we can help those patients actually get a better effect without maybe some of the side effects or even some of the treatments that may not respond to their specific type of obesity. So how will we achieve this within this European Union project is we will have 8 work packages. Work package 2 creates a federated database where we can make discoveries in work package 3, 4, and 5 about the predictors of risk and predictors of response. Then we can validate these predictors in work package 6. But then we have to underpin this by the patient voice in work package 7. We have to find out what patients fear, because those are the predictors of risk, and what patients hope for, because those are the predictors of response. So we can bring together the science together with the logic, together with the emotion to really change ultimately in work package 8 and create a shared value between all of the stakeholders. And who are the stakeholders that we are addressing? Here we are thinking about the social needs of our societies, of our patients, of people living with obesity. We're thinking about governments and their government assets, for example, their healthcare systems, their public health systems, that's really being burdened at the moment by the complications of diseases such as obesity. And ultimately, what are the business opportunities for companies that work in Europe so that they can flourish, so that they can employ people, so that we can build a European economy together? And this idea of shared value was really being put forward initially by Professor Michael Porter in Harvard when he came up with this idea that, industry need to do the right thing and they need to do well by this. The concept of doing well by doing good. You have to approach these big social problems so that we can solve them. And of course, one way to do this is to create scalable solutions that are profitable. And that's really the focus of shared value. So we have a massive social problem of the disease of obesity. And here I'm showing you what's happened to the disease over the last 40 or 50 years within Europe. And despite our best efforts, you remember Sisyphus, this was our government building, rolling this rock up this hill. But despite their best efforts, it's been unsuccessful. So one stakeholder on its own trying to do this is not working. We need to bring all the stakeholders together to work together to address this important social problem. And how can we address the social problem? We can do this by scalable solutions. We can find better nutritional therapies, better pharmacotherapies, better surgical therapies, because now we know about this disease that we can address the disease by treating what happens in the subcortical areas of the brain. And we know we are successful when patients come back and say, doctor, since you've started this treatment, I don't feel hungry anymore. Since you've started this treatment, I feel more satisfied. And my appetitive behavior, I am no longer driven to food. That has reduced. So we know that we can find these scalable solutions now, and those could be nutritional therapies, pharmacotherapies, as well as surgical therapies. But these scalable solutions can only be implemented if it is profitable. And when we think about profit, we refer to all the stakeholders. We talk to patients. They need to find a profit. It must be easy for them to have these treatments, and it must be sustainable because obesity is a complex and chronic disease. We think about our clinicians. It must be profitable from them, even if they work in public systems, so that they don't feel they're rolling up this rock up a hill and it's of no value. They must have satisfaction that they are really treating a disease and they are really helping our patients. It also must be profitable for industry. They must make a financial profit, because otherwise they're not going to invest in new treatments and they're not going to scale the treatments that they have. It must also be profitable for governments, because our government systems are really being put under a lot of burden because of the complications of these non-communicable diseases, such as obesity, and many of them driven by obesity. So it means that all the stakeholders must profit from these approaches. So what is SOPHIA aiming to do? We're aiming to build a shared value based on discoveries, scientific discoveries, but also the discoveries of what our patients want, the patient voice, so that we can change the narrative and we can build a shared value with all of the stakeholders that are involved. And this ultimately is going to allow us to treat this disease far more effectively. Thank you very much.